Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of the interest to our community. Today, I have Jodi Frei. She is the Manager of Clinical Informatics at NMC, and she's worked at the hospital for 13 years. Today, she's here with us to talk about patient portals and accessing your electronic medical record. So Jodi, thank you so much for being here with us today
My pleasure.
Talk about this, because we're moving into this electronic world, and I know this isn't the first time that you've been on this show to talk about a patient portal, but let's start back a little bit at the beginning and just to remind folks, what is a patient portal and why is it important to the community?
Sure. A patient portal, Jill, is really an extension of our electronic medical records. Whenever any patient steps foot into Northwestern Medical Center, whether it be at the hospital or at one of our physician offices, the people who take care of our patients document the patient's care within the medical record, the electronic medical record. And from that, we are able to send the information to a patient portal so that the patient can be part of this process. The patient can access the information about their health care, about their medical history, their medication lists, the treatment plan, some educational resources that will be available to them based on the condition or the diagnosis that they presented with. So it can be a very valuable tool to our patients, and studies have actually shown that through engagement with a patient portal, patients can improve their outcomes. They can improve their long-term and short-term outcomes.
Wow. So that sounds like it's interesting to the community to know.
Yes.
So when you go into the portal, what type of information will there be?
Sure. There's a variety of information. When patients go into the portal, they can see recent test results. So we have lab test results, diagnostic imaging, X-ray, MRI results. They can see discharge instructions if they've recently been admitted to the hospital. They can see any appointment that they have scheduled within any portion of our organization. They can communicate back and forth with their provider if they have questions about their care, questions about their bill. They can communicate back and forth with our billing department. They can also see an itemization of their bill and what is pending insurance and what is due out of pocket at this point.
Now, can they actually make changes in their own portal?
Yeah, they can't make changes within the medical record, but they can communicate back with their healthcare team to let the healthcare team know that a change needs to be made. So if the patient is looking at their medical history, or a patient is looking at their medication list, and we missed or we forgot or a new med has been added to the medication list, patient can, through the portal, contact the medical office or contact our pharmacy and request that medication be added to their medication list.
So how do folks get access to the portal?
Yeah. Right now, Northwestern Medical Center has two separate patient portals because we have two electronic medical records, one that we use for our hospital-based services and one that we use for the services that we provide in our doctor's offices. And there's a slightly different process for each portal. But the good news is that if anybody goes to northwesternmedicalcenter.org, our website, there are very clear instructions and links to the patient portal.
So if you haven't got an account, you can just go to the portal and sign up?
You can go to the portal and find instructions on how to sign up. For our hospital portal, you could go to Northwestern Medical Center, our website, and sign up. In order to access the physician office portal, you have to have a piece of paper that is provided to you by your physician clinic.
Okay.
Yeah.
Okay. So any new changes that have been made since the last time we talked?
Yes, we have changed the amount of time that transpires between the time results get resulted and are posted to the portal. When we went live with our patient portals a couple of years ago, a decision was made to delay the results of lab tests and diagnostic imaging tests 24 hours. And the intent was to give providers time to communicate with patients in regard to their results. And really based on patient feedback and the culture throughout not only our community but the nation, patients are asking for this information immediately.
Yeah, so true.
I want to know my results. So that's what we have changed. At the beginning of this year, we eliminated the delay, and patients can now access their results, their lab results, their diagnostic imaging results, their mammography results, as soon as those results come in.
Now with that, I mean, when physicians or providers are really busy, that might mean that the patient might get their results before their provider gets the results. So, you know, how should they handle that?
That's a very good point. Providers and our physicians, when they order exams now, are having conversations with the patients to let them know just this.
Okay.
You may see this result before I am able to follow up with you, but rest assured the providers are being alerted to those results. If the results are critical results, we have a process within the organization that the providers are contacted immediately, so that they then know to pick up the phone and call the patient and have a conversation about those results. When ordering tests, providers are also explaining to patients, if the result is positive, then this is the direction we may take. If it's negative, this is the direction we may take. So starting to have some of those conversations at the point that the test is ordered.
Right, so they can know what to expect.
Exactly.
Yeah, okay. So does the provider use the portal? The patient uses the portal. Is the provider or the provider end using the portal as well?
Yes. The provider or the provider's office uses the portal to communicate with the patient. So just as we talked a little while ago about patients being able to communicate questions or concerns or updates to their medical record, providers are communicating with patients. So we are communicating that follow-up visits have been scheduled. If the physician makes a referral to a orthopedist or referral to an ENT, the provider office generally schedules those appointments after the patient's leave, and he or she may communicate through the portal, this is the time and date of your follow-up appointment. We're communicating sometimes results back to the patients via the portal, and we're communicating educational material. We're providing educational material regarding a visit or a condition to the patients through the portal. So it's very exciting.
So will I get a message that might have information on the portal? So how will I know if there's something there waiting for me?
Yep, you'll get an email alert when you sign up for the portal. You provide your email address, and you'll get an email alert saying you have new activity on your patient portal.
Okay. So if I come into the hospital as a patient, do I get introduced to the portal in any way?
You do, yes. When patients register or come in and sign in for their visit, the registrar at the desk will explain the process of signing up for the patient portal if that patient has not yet signed up for the portal. So we have educational material, we have handouts that describe step by step how to access the patient portal. We also have some resources within our information systems department to help people if you're still struggling or for whatever reason you just couldn't access the portal. Then you can call our information systems department, and Penny LaFlame will gladly step you through the process. She'll take as much time as need be.
So do you anticipate other changes coming? What's coming down the pike
well,
here?
You know,
there's got to be something happening.
Actually, yes, I'm very excited. Right now, our portals mostly contain medical information specific to visits, but we want to launch into prevention. We want to connect the Fitbits to the portal and have patients thinking about what can I do to prevent illnesses as opposed to come to be treated for them.
Wow, there's a lot to come.
Yes.
So, you know, one of the things we think about is identity theft. So talk a little bit about the security. I mean, all my information's on this portal.
Right.
And you hear so much about access and hacking, and what does this mean for patient confidentiality and protection of information?
Yes. Patient information on our patient portals and within our electronic medical records is secure. It's protected. Your patient portals are password protected, and we do not recommend that anybody shares their password with anybody else. Above and beyond being password protected, the information on the patient portal is encrypted. So essentially, if somebody were to hack into our patient portals or our electronic medical records, the information would not make sense to that person. It's gibberish, if you will, because we have standards of encryption within our systems.
Well, that's good to know, because I think that's a worry, and we keep hearing more and more about this type of activity. So, and the last thing you want to lose is your personal information and identity, for sure. So I understand the Healthy Hearts on the Move is coming up, and what's going to be happening? Is there going to be access to information there?
Yes, definitely.
Or any other community event? Where can we find you?
We are trying to be wherever the community is. So our Healthy Hearts is coming up, and we will have a patient portal demo, so patients can come, anybody can come over to our booth and see our 2 patient portals, practice navigating, get a little flavor of the look and feel of our patient portals, and hopefully people will be very pleased and excited to sign up.
Great. Well, thanks for getting so much out there when someone walks through the door or in a community. So it's so important to help folks get connected with their information.
Exactly.
So tell me a little bit about your background and how that got you to be a clinical informaticist and a manager. So what's your background?
Sure. So I'm a physical therapist, and I've been practicing physical therapy since 1990. And in this day and age of this growth of technology, I was drawn, after over 20 years of practicing PT and managing, into this realm of technology. It amazes me that we can leverage technology to improve our patient outcomes, and that's what we're doing at Northwestern Medical Center in the Clinical Informatics Department. Is we are leveraging technology. What can we do from a technology perspective to make sure that the patient has the best experience at Northwestern Medical Center? How can we make sure that we provide the right information to the people who are caring for our patients to make sure that we have the best outcome possible for our patients? And to me, that blend of the clinical and the technological perspectives is just very gratifying, in that we can up our ante. What can we do? How can we use the latest and the greatest, the most innovative approaches to improve patient care?
Love your passion. But this isn't replacing, the doctor or the nurse coming in talking to me, right? I don't want them on the computer. I want to be talking to them. I want them to hear me.
And we do not want to have a negative impact on that experience at all. And sometimes when technology is new and providers are trying to figure it out, there's a little bit of a barrier there. But really, it's about, instead of a pen and a piece of paper, we've just put a laptop in front of them. But we do not want to impact that conversation that the providers and the nurses and the therapists are having with their patients. We are always listening. We're always listening.
You can't replace that, can
No,
you?
you can't. There's nothing more better than the personal touch.
Absolutely. So I think that's, we're almost out of time, but I'm going to ask a question that I know the community wants to know, because if you go to a different provider, do you forecast soon that the records are going to be able to be shared across different entities? It sounds like NMC has a connectivity kind of internally and with their practices. Yeah. But what about others? Because we take, pride in working with our independent practitioners and our community health providers, and is that day going to come, you think?
That day has to come, Jill.
Yeah.
I mean, we are no longer in a place where we treat patients in a silo. We are treating patients as a community. So we need to be able to connect with the other providers within the community, connect within the home health agencies and the skilled nursing facilities. We're all caring for our patients. And so we are in the process of, we actually have an active Franklin Grand Isle infrastructure or IT committee that's talking about how do we share that information so that when the patient crosses setting of care,
Right.
how do we make sure that the providers get the right information, that we're not duplicating exams, that we have an awareness of what happened at the hospital so that we can continue care and not start at square one and try to figure out the patient's situation. It's really about continuity of care, and it's no longer about what's happening within our four walls.
Exactly, exactly.
Yeah.
Well, you've been a wonderful guest, so thank you so much for coming back, and I'm sure you'll be back again because there's a lot of exciting changes in how we're trying to connect information electronically.
So thank you for having me.
Thank you. This is Jill Berry Bowen, your CEO of Northwestern Medical Center. Thank you for joining us today to talk about access to your electronic medical record through the patient portal. And yes, we will connect all of this. It does take time, and we appreciate your patience. Thank you for joining us.